Doc's in. We're talking lower body, I guess, really, right?
Yeah. Yeah. So what we were discussing before the break is that the pelvis, hips, knees is all connected into one system. And so many times patients will go to the doctor with knee pain, and the doctor will look at the knee. But what's not looked at many times is the relationship between the arches of the feet, the alignment of the knee, and the level of the pelvis. It's one system, so not three. And so in order to truly find the underlying issues for the long term, it needs to be evaluated as one system, not three. So what I'm saying is that it may not actually be a knee problem. Your knee may hurt because your arches are collapsed, or your arches may hurt because your pelvis is torqued out of place, or your knees may hurt because your pelvis is off, and so on. It's all a kinetic chain. It's all one system.
You know, we don't stop and think about that.
When you stop and think about it, though, it makes perfect sense.
Absolutely.
It's kind of like, I guess, a car. And if the radiator is busted, the car's not running.
Right.
Even though the transmission is fine.
Yeah, you know, it's all connected. So you have to look at the system as a whole. And so what happens, the reason this happens is, let's say that half of your pelvis, let's say your right side of your pelvis is torqued out of alignment, which is very common, by the way. That will rotate the upper bone in the thigh, the femur. And your knee is a simple hinge joint. The top and the bottom have to be in alignment for a hinge to work properly. So if the top part of the hinge is twisted from the bottom part, it's going to cause you pain and arthritis and deterioration and so on. So if you don't address that and you just look at the knee, a lot of times you can't find what's truly going on. So that's actually a pelvic problem. The knee pain is a side effect of what's really going on, and eventually it will wear itself out because the knee is a simple hinge, just like the hinge on your door, and it has to be in alignment from each half in order to slide smoothly. And just like the arches, if one of your arches in your foot has collapsed, it will buckle the knee on one side and drop the pelvis on the other side. So, you know, all of this is connected.
Can I look at my foot and know if I have an arch that has collapsed?
It's pretty hard to.
Really?
I have a digital scanner in my office that it has a piece of glass that you stand on that has a scanner underneath your foot, and it will scan the weight distribution of your foot and give us a printout of what your arch is actually doing. We can determine if you have plantar fasciitis or, you know, anything like that.
What exactly is the arch? And what is plantar fasciitis?
Well, I'm going to say this fasciitis. In 1978, I went out on a date with her.
It didn't go well.
In Burtonville, Louisiana.
She broke up with you?
Yeah, she broke up with me.
Broke your heart?
Fasciitis, whatever. Yeah. Bye, Felicia.
Yeah. So the feet are very important. They take a tremendous amount of stress. You know, whenever you add up the stress on the arches of our feet, if we walk around throughout the day, it can add up to a fully loaded cement truck by the end of the day. You know, if you add up each one of those steps, the poundage in each one of those steps over your day. So it's tremendous amount of force on our arch. So yes, if your arch is collapsed, the tendon that runs from your toes, or from the ball of your foot, I guess, to your heel is your plantar fascia.
Okay.
And so if that gets strained or inflamed or irritated, that's called plantar fasciitis.
Okay.
And it's very painful, and it can be very difficult to get rid of once it happens. So if you're starting to get a little bit of irritation in the bottom of your foot, you want to get that looked at right away. We need to scan your arches, because once it gets severe, it can be very, very difficult to get rid of. And the reason why is because you've still got to walk around.
Right.
You know, if you sprain your elbow, I can put a cast on it.
You can still get around.
And you can still get around. But you can't. So the arches of your feet, once they develop this irritation or this sort of micro tears, it can be very difficult to get rid of.
Never has the opportunity to heal.
Exactly. So I would almost have to keep you bedridden off of your feet for 8 to 12 weeks. So it's very important that we address it in the beginning with this irritation of that tendon.
So there's a treatment that can speed up
Absolutely.
healing, basically.
Yeah, there's a whole treatment protocol. We have a whole program we have a whole plantar fasciitis program that we take you through step-by-step ways that we can get rid of it. So it can be addressed.
I'm sure
it's just a difficult thing.
I'm listening to you, and I know it's a painful thing, and I don't think I have it. I know it's a painful thing, and it's probably, I mean, it's difficult for people to get rid of and everything, and it's a thorn in people's side. I understand, but God, it sounds funny when you say it.
Plantar fasciitis?
It just does to me.
It is kind of a weird name.
That's a weird name, Doc.
Yeah. So basically, the way you'll know you have plantar fasciitis is that
it just makes me happy when you say
Not
it.
if you had it.
Not if you have it. Oh, I'm sorry.
So what'll happen when you first put your feet on the floor in the morning and you stand up and it's very painful, like when you first start your day, that's textbook plantar fasciitis.
Wait, so does it? So it never? You're saying the pain never goes away?
No, it can come and go.
Oh, okay.
But when you first put your feet on the floor in the morning, it's typically very painful. Or after you've been through your day, and in the afternoon when you sort of sit down to rest, your feet will bother you. But this can also show up as knee problems. Like I said, it's all a system. The pelvis, the knees, and the feet are one system, not three.
Okay, I'm going to put you on the spot. And if you can't answer it, just say, I'll get back with you. Why do, on average, what causes feet to swell most of the time?
Yeah, very good question. So what happens, there's some little one-way valves in our veins that whenever our heart pumps, there's nothing to pump the blood out of our legs back up to our heart. And so there's some little one-way valves in there that when your heart beats, the blood goes up the vein and it stops it from draining back down in the feet.
Okay.
Well, as we age or as we lose our health, those valves get a little leaky, so the blood has a tendency to pool in our feet. Not a very good thing to have. So, these little one-way traps kind of keep the blood up the vein as your heart pumps. It keeps pumping it up, and it doesn't let it sink back down to our feet.
Can you fix that?
Not so much,
Once it starts to happen, it's kind of there. Huh?
Yeah.
It's not part of that leaky gut syndrome or anything.
No,
is it?
totally different.
Okay.
Yeah, which is a whole
You're just
show
talking
by
about
itself.
little valves in veins that stop working properly.
Yeah, little one-way valves that they kind of are closed together, and as the blood pumps, they shut back. Kind of like shutters, so that they stay closed, and that keeps the blood pushing up towards the upper part of our body. And they get a little leaky as we age, and they get a little old, and they start to let the blood pool in our feet. And so
yesterday, I forget where I was, but I looked down at my right foot, and no,
that's a good thing to do.
See, I looked down at my right foot. I was looking at my feet. I forget what we were. Maybe we were even talking about feet, or no, somebody was talking about the skin, somebody's skin or whatever on their legs, and so I looked down at my feet because I was wearing shorts, so I looked down, and my right foot was swollen. Like, it didn't hurt or anything. It was just kind of puffy and larger than my left foot. And I was like, the doc's coming in tomorrow. I'll ask him what that's all about. So that's why the question.
And it also, when I was flying on vacation, we had a very, very long flight, and I noticed I was a little puffy around the ankles at the end of that flight. Is that from flying?
From the pressure change, probably. The pressure changes in the cabin. So
she went to Alaska. I went to Colorado. Could this be some remnants of the trip?
Maybe.
Oh.
Actually, with your right foot swelling, could be from the back issue you were asking me about earlier.
The way?
The back issue.
Yeah, I have back problems right now.
It could be connected, so we'd look at that.
By the way, I need seriously, on the air. I want to say this publicly on the air.
That means I can hold you to it now.
Yes. I need you to look at my back.
I will.
Seriously.
All right. I will take a look at it.
Okay. All right.
You can call us at 837.
I hate you. I hate
7174.
I'm not calling. I'm telling you now. I need you. Anyway.
You want me to send a limo to pick you up?
No, I don't.
Yes, he does. That's what he
He does, doesn't he?
No, I just want you to tell me when I can go in. That's what I want.
I will let you know.
Text me when you have an opening.
Okay.
Golly. See how he treats
I will
me?
do that. We will do that.
Because I understand, because there are people that I've sent to you, and you've helped them tremendously.
Good.
There's a guy, well, I'll say it, Cody. You saw Cody. Cody had back problems for ages. Well, we have a mutual friend, and he called me, and he said, this guy that y'all have on the radio, Dr. Kevin, I said, look, just call him, take Cody over there, he'll fix him up. This man had back problems for years. You fixed that man. That man, right? I saw him just a few days ago, and he's standing straighter than a toothpick. Oh, he's fine now, thanks to you.
In a pretty short time, too, in his case. Yeah.
JC, I was back in the office, and JC says to me, he says, you know, the doc has really helped me. Because JC for a while there was looking kind of ragged, just like he was worn out. And I was like, there's got to be something going on with JC that he's not telling anybody. And come to find out he was having, because he's kind of he's private like that.
Yeah.
And he says...
Until now.
Well, don't tell me nothing. But he says to me, he says, you know, I've been having these back problems, and I've been going to see Dr. Kevin, and he's helping me tremendously. The back pain is going away. Whatever you were doing helped him. And now he's fine. He's fine. So I'm like, meanwhile, I can't freaking stand up straight. Nobody's offered to help me. So now I'm serious. I'm asking you publicly. I need to go see you because I had back surgery about 20 years ago. And it's kind of feeling like all that again. And I don't want it to feel like that again. And I don't want surgery again.
Nip that in the bud.
I know. Yeah. I know. I want you to help me.
All right.
Please.
We'll do it. We will do it.
I got insurance.
All right.
Now, back to what you wanted to talk about, Dr. Kevin.
So, all right. So now that we're done talking about CJ,
I'm just trying to give you a commercial to let people know how
appreciate
good
that.
you are.
I really,
we just have to give you a hard
I do
time.
appreciate that. You know, and we do so much. We do so many programs that people aren't aware of in our office. I mean, we have everything from weight loss programs, hip and knee programs. We have custom foot programs that we do. I mean, we do so much that people don't even realize that we do. And we're actually going to be in the next couple of months making a very cool announcement that is going to actually revolutionize our entire practice. So we're
something new to the Acadiana area.
Yes, it's going to be remarkable. But listen, this rapid release is something that's going to break up the scar tissue in extremities and in the lower body is really going to be a huge benefit for somebody with hip, knee, and foot problems, in addition to the foot scanner that I talked about earlier and trying to relieve plantar fasciitis. And
is this an accurate statement? Scar tissue hurts
Yes.
sometimes.
Yes, very much so.
Okay.
It's very painful. Fibrous adhesions, very, very painful.
And if you can break down the scar tissue without cutting on someone, this is great.
Yeah, absolutely. Yeah, because when you cut, you create more scar tissue.
Exactly.
Yeah, so that actually helps temporarily.
This is, what do you call it? Non-invasive?
Uh-huh.
Non-invasive.
Non-invasive.
Okay. All right.
Not evasive. Non-invasive.
Non-invasive. Okay. Hey, I was saying sherbet this morning or whatever, and it's sherbet.
Yeah.
I didn't know. Because I'm from the country. Forgive me.
That's it.
Okay.
So, yeah, if you want to come to this workshop, it's going to be Monday night at Try Running in Lafayette. They're a fantastic organization. You can call 837-7174 and register, and you can come see my hip, knee, and foot program. If you're having any problems in those areas, come check this out. I'm going to show you how to solve these problems so that you can continue doing your activities, because if you lose your ability to be active, that's going to affect your heart and your weight and your diabetes and everything else. So, address it. Make sure you address it now.
All right. Thanks, Doc.
All right, guys.
Give out the phone number once again.
837-7174, and we'll forward it over.
841 Wellness Wednesday on KTDY.